Almost a fifth of the nation has been diagnosed with an anxiety disorder, making it the most common mental health condition in the United States. With a large handful of these individuals accessing help through primary care settings, clinicians often deal with an anxiety caught in a web of comorbid physical symptoms. Most recently, the association between anxiety and heart disease has been spotlighted. Heart disease is currently the leading cause of death in the United States, making it a pressing topic in healthcare and leaving a crucial opening for behavioral health to intervene and minimize the compounding impacts on the entire family. The aim of this video is to help physicians, behavioral health professionals, and training institutions view just one way to conduct an integrated and comprehensive family-centered medical visit. Our video will highlight efficient and thorough care using a biopsychosocial lens with the purpose of helping and intervening early in a couple who is struggling with anxiety after a pulmonary embolism event landed one of the partners in the hospital. While there are many different presentations of anxiety and many different evidence-based interventions that can be used, we chose just one way to work with a couple in this context. In this video, you will see, first, a precepting discussion with faculty, behavioral health, and a resident. Second, a co-visit with a resident and a behavioral health consultant. Third, one example of a brief behavioral health intervention you could use for couples with anxiety. And four, a warm handoff to a care coordinator.
In this first part of the video, you'll see a precepting discussion, which can happen before, during, or after appointments. In addition to obtaining supervision around the medical piece with a faculty member, residents often bring in other professionals. This can be an opportunity for providers to coordinate a think tank and invite professionals who could be involved in the visit to optimize care. It is also a place to brainstorm and predict some biopsychosocial needs of the patient and their family. This process allows us to establish a plan before the care team goes in. This improves efficiency for the patient and the clinic without compromising care.
Hey, Dr. McCarthy, I've got a patient to staff with you.
Hey, Travis.
Maya and I have actually already discussed it a little bit from behavioral health,
Okay.
so she at least knows a little bit about what's been going on. It's a 55-year-old gentleman. His name is Scott. He's in here today with his husband, Paul. He has a past medical history that includes AIDS positive. He's on antiretroviral therapy in the form of Veramir and Descovy.
Okay.
He also has a past medical history of bipolar disease and schizophrenia, well controlled on a few medicines. He was actually hospitalized a couple of weeks ago for a pulmonary embolism of unclear origin. No recent travel, no surgery, no medication changes, but he is anticoagulated on Eliquis right now. He's come down to the 5 milligrams twice a day. There seems to be kind of a multifactorial reasoning behind potentially why he's had some worsening anxiety over the past few weeks. It sounds like it could be underlying anxiety related to his mental health disease. Sure. It could be from his recent illness, hospitalization, or just worry moving forward if something like this could happen again and what the future holds.
Totally understandable.
As far as prior mental health history, he has a family history, father with schizophrenia, mother with some non-specified mental health disorder. PHQ-9 today is 9, GAD-7 is 10. Those are increases from when he was seen a few weeks ago prior to being hospitalized. So This does seem to be an acute elevation in a lot of those scores. So I've already talked with Maya a little bit, and I think we have a plan moving forward for today, hopefully.
Okay.
Yeah, a couple things that we're going to kind of think about is maybe how his bipolar and schizophrenia are playing into the anxiety, what his husband has done to manage anxiety in the past around this, and how it's maybe changed since the pulmonary embolism. And so we're going to kind of figure out a way to utilize all of our team members today. So we're going to start with a co-visit with just Dr. Williams and I. Then I'll do a brief intervention around the anxiety that specifically has manifested since the pulmonary embolism, and then try and get care coordination in there to really help wrap around resources or hospital expenses, those kinds of things.
Okay.
Any other things that you could think of how you would approach this situation, things you've seen before in the past that maybe played out this way?
Sure. I mean, From a medical standpoint, it's kind of optimized on the Eliquis, so I think it makes sense to get the rest of our team involved, because it's really going to be kind of that fear of having a life-threatening event that's going to linger on.
Absolutely. Absolutely. So I think we'll get that started today and see how we can help them moving forward. After a precepting discussion, the resident and the behavioral health provider will go in for a co-visit together. We decide ahead of time who will take the lead and use both of our areas of expertise to help understand the problem and create a treatment plan together. Our main goal here is to elicit and elaborate on patient and family concerns. Physicians who may be familiar with the BATHE technique or motivational interviewing can also incorporate Cole and Seaburn's 5 areas of questioning for family-oriented approaches in primary care to address how the family dynamics impact the problem. These fundamental questions are: has anyone else in the family had this problem? What do family members believe caused the problem or could treat the problem? Who in the family is most concerned about the problem? Along with your illness and symptoms, have there been any other recent changes in your family? How can your family be helpful to you in dealing with this new problem? You will see us incorporate these questions throughout our visit together. Hey guys.
Hey.
We're back. I brought my good friend with me, Maya. She's one of our behavioral health providers.
Okay. Hi, Maya.
Hey, Maya.
Scott and
Maya,
Paul.
nice to meet you.
Good to meet you,
Paul,
Maya.
so good to meet you.
We're going to go on ahead and sit down, guys, okay?
Sure.
So I filled Maya in a little bit about what's been going on, how we've mostly talked about the medical side of things during our earlier time in the visit.
I see.
So I let her know everything else that's been going on, such as your anxiety being a little bit worse since you've been
Yes.
in the hospital. And maybe that there's a few components to that that could be exacerbating it.
Yes.
So sometimes it's really helpful in these situations where we get a few people involved to help us out. But I also think it's good to have family members come in and talk. So it's more of a dynamic process. So we have a few voices that are being heard,
I see.
all centering around the fact that this is still all about you, Scott. We're still
Okay.
trying to figure out what could be the most helpful for you moving forward, while also getting Paul's input and what he feels could be helpful as
I
well.
see.
Does that make sense?
It does make sense, Doctor, yes.
So if it would be okay, because I know you guys have had a ton of stuff going on, you've talked to a lot of different people. If we could just kind of get each person's point of view just for how these last few weeks have been going, how you've been feeling since you got out of the hospital, and then maybe get Paul's perspective on top of that.
Okay. All right.
Yeah. So how have you noticed the anxiety in your daily life?
Well, I noticed, I know when I'm going into an anxiety attack or a panic attack.
Mm-hmm.
I can almost see it coming.
Yeah.
And depending on the situation and how extreme is it, depends on how extreme my anxiety attack is.
Mm-hmm. Yeah. Yeah.
So I deal with it the best I can with meditation and
Cool.
meditation, prayer,
Mm-hmm.
things like this to try to back it off
Yeah.
and get it to stop. Doesn't always work, but at least I've got it, right? I've got that out. And sometimes it does help. And when it does, that's, that's a good thing.
Yeah, it sounds like one of the things you recognize is that you know it's an anxiety attack. You're able to really focus, oh, this is anxiety.
After
And you
so
kinda
many
know
years.
the symptoms. Mm-hmm.
After so many years of it, yeah, I recognize it.
Yeah. Tell me what has changed, and I'd love to hear Paul's input on this as well. What have you noticed change in the anxiety since the pulmonary embolism, since you leaving the hospital? Have you noticed any symptoms changing?
Not necessarily symptoms, but I think the worry it's going to happen again, and I can see it in him.
Yeah.
Well, I could be dead tomorrow, type of thing. It's like
Right.
and it's just, and I just reassuring myself, well, the doctors are taking care of you the best they can. They put you on a medication to help fix the situation, and I try to reassure him in that way that He doesn't go into full-blown explosion. of
Anxiety
attack.
attack.
Yeah.
Nice. It sounds like
Because
you're real reassuring.
Yeah, because I will sweat and perspire and get all strung up
Okay.
on an anxiety attack.
Yeah. Yeah. What other kind of physiological symptoms are you noticing, either of you?
Physiological?
Yeah, meaning in the body, like sensations in your body. Like, does your heart rate increase ever?
Yeah.
Yeah, you notice that.
It
Okay.
does.
Yeah, you mentioned sweating and
Yes,
is there
perspiration.
anything else maybe you notice, Paul, in your review?
It's either up or down. The best way to, sometimes it's just a mile a minute. This is going to happen, and going on and on about this could happen, this could happen. Well,
Yeah.
yes, babe, anything could happen at any time to any one of us. It's just, it's not. And then other times he'll shut completely down and won't say anything to me at all.
Yeah.
So it's just kind of like I said, it's either here or here, and I try to bring it to where it's here. And sometimes it works. I mean, just by reassuring him, and so.
So initially, after finding out that I had this pulmonary embolism, I have been high strung because they said that I could have a stroke at any time. It could cut loose. One of the blood clots could cut loose and go to my brain and cause a stroke.
Yeah. It's terrifying.
So that's anxiety. You know, it's very anxiety. And very high strung about that. I've tapered off since it's been about a month since I've been in the hospital, a couple weeks. Yeah, and I will. I continue to kind of not get over it, but get past it easier than the time before.
Yeah. I'm so glad you both were able to recognize that anxiety has two kind of manifestations for you. That there's one, this fight or flight activating anxiety that makes your heart rate beat really fast, you're sweating, right? And that's the fight or flight mechanism, right, kicking in.
Yeah.
And then there's also that freeze response, right? The shutdown, right? Of this is too much to handle. I can't, kind of manage that. I might have, kind of be a little more lethargic or apathetic. And those are both manifestations of anxiety.
I see.
And it sounds like Paul has been able to be a real resource in not only recognizing that, but also kind of helping bring it towards what we call the window of tolerance, right? That space where you can kind of manage it a little bit easier.
I see.
Is that true?
It is true.
And I just find if I can bring it to that center level, we can have a conversation about it.
Good.
But if he's up here or down here shut off, it's hard to have a conversation. So I try to get him to that level where we can
Awesome.
talk about
And I love that you all are already doing that. It sounds like you all have a well of strengths in that, and I can tell how connected you all are in
It's just
that
the
way.
way our relationships always work, though.
Yeah. Yeah. And I was wondering if we could offer you, another kind of tool to help both of you kind of maintain that window of tolerance, maintain that middle balance that you were talking about, Paul, so well. And maybe after Dr. Williams and I are done with our co-visit, we could actually just meet for a brief second and kind of learn a new intervention or a new kind of thing that might help you all.
Sure.
Would you be
I
interested
see.
in that?
Yeah, that'd be great. I
Yeah.
would really appreciate that.
Awesome, and that's something that we can do at any of your medical appointments with behavioral health. Someone like me can come in and do a brief intervention, teach you another little tool to put in your pocket for those days when anxiety gets out of that.
I'll take it.
Awesome.
I will take it.
And you guys probably see what we're kind of already hinting at, that sometimes these lines can blur and it's not always exactly clear what's going on. So we sort of approach this in a way that we call biopsychosocial. So bio is I'm helping you from a medical perspective, and then the psychosocial are things that we can help from a mental health standpoint, and then other resources socially that may help you guys that could cause increased stress, increased worry, or things in the community that are resources that could just make your life easier.
I see, doctor. Okay.
And so we like to highlight a lot of those things here in the clinic, that we're really lucky that we have someone like Maya from behavioral health. We have a care coordinator that can help us out with making phone calls for you guys, helping with scheduling, things of that nature. There's support groups in the area. There's also therapy, if it's physical therapy, occupational therapy, from you going through so much and being in the hospital for a few days.
Yeah.
Are there any things that you guys feel like have been more difficult since being in the hospital, whether it's medications, going to appointments, transportation, housing, food, anything that comes to mind that we could maybe help you with?
Well, no, but I still have dizzy spells and fainting spells.
Okay.
Not every day, but they're fewer and far between than before I was in the hospital.
Right. And those are things that I want to make sure that we keep a close eye on and
Okay.
help you with, because that can potentially make you even more worried after what you've recently been through.
I put everything on my phone and my calendar, so if I die, go there.
Gotcha. I'll know where to check.
You'll know where to check,
I'll know where
Doctor.
to check.
Yeah, Dr. Williams.
But he has a hard time remembering appointments.
Oh, I'm terrible.
So.
And names.
And he puts them in his phone, but if the alarm doesn't go off, he'll set the alarm for the time of the appointment. Well, that's not very helpful.
And that's a common thing that we hear from folks that have recently been in the hospital, been through a major medical stressor, is I haven't really been seeing a doctor that much, and now I've got 3, 4, 5 appointments in a month. And that's a lot to keep up with. It's not just
Yeah.
as simple as putting it in a planner. Sometimes you just need a little bit of help from someone. So that's someone like our care coordinator can give you a call a day or two before the appointment and say, hey, just to check in, you've got the appointment with the lung doctor coming up next. Just as someone else that's keeping a close eye on things.
I see,
Does
Doctor.
that make
Okay.
sense?
Yeah, absolutely makes sense.
Okay.
Mm-hmm.
Well, great. Let's, Dr. Williams and I will step out, and then I'll be right back for a brief intervention. Does
Okay.
that sound good for you all?
Sounds good.
Awesome.
It was good to see you guys.
Nice to see you,
as
Doctor.
well.
Y'all take care, all right?
Thank you.
When the medical portion is done, the physician will step out, and behavioral health can conduct a brief intervention, which could be anything from working through family-oriented grounding techniques, diaphragmatic breathing, or solidifying treatment goals, or even helping the family or couple track how anxiety is connected to their medical condition. A number of psychotherapy interventions have been found to be effective with this specific patient population, including CBT, cognitive behavioral therapy, and biofeedback. And each therapist may take a different approach based on a variety of factors that the couple brings. For this couple, I noticed they're extremely connected and might find it easier to co-regulate than to manage anxiety or stress individually. Because their anxiety often manifests in physiological symptoms, I'm going to help them soothe their nervous systems first. Then maybe in a later session or co-visit, we can use a more cognitive approach. In a second, I'll demonstrate a brief intervention. Parts of it are taken from a co-regulation exercise created by Stan Tatkin and his psychobiological approach to couples therapy, or PACT. I weave in a diaphragmatic breathing and mindfulness approach to help lead them towards self-soothing their nervous systems alone as well. So we've talked a little bit about how anxiety has been manifesting between you two with after the pulmonary embolism, and also how you've noticed the signs and symptoms, and also all of your wonderful coping mechanisms that you said, the meditation, kind of noticing the anxiety cycles as well.
Yes.
And those are all so wonderful. And I'm really glad that you all have kind of not only talked about this, but also been leaning on each other for support. I thought we could just do a little intervention that can help when you all are together and the anxiety is, you're maybe noticing it in Scott, and Scott, you're feeling a little bit stuck, right? You're feeling like, Paul reassured me, but I'm feeling a little stuck.
Yeah.
Maybe because of that chest pumping or tightness or some of those, body symptoms that feel a little bit harder to manage. So we're gonna try a little something. How do you feel about doing that?
Sure. Sounds good.
Okay, so what I'm gonna have you both do is turn your chairs towards each other so that you're just facing each other. You don't need to look at me. Beautiful, wonderful. And you're just gonna ignore my face, look at each other, just listen to the sound of my voice, all right? So, I just want you to start by looking at your partner and noticing where you're seeing stress in their body, in their face.
In his body right now.
In his body? Okay.
He's very tense.
Yeah.
Tension.
Yeah. Where do you notice that stress, Paul?
All over his face, actually, because when he is, I can see stress in his face.
Yeah.
And that's how I'm able to notice he's getting stressed out or being anxious about something.
Good. I love that you're really attuned to the way that his face manifests stress, even if he's not talking about it. Wonderful. Any other places you're noticing stress?
Just in his body language.
Body language. Good. Okay. What about you, Scott? What are you noticing in Paul right now?
He's relaxed. He's calm. I don't see any stress.
Okay, good. How does that make you feel, noticing that he's like that?
Makes me feel good for him.
Oh, good.
It helps bring me down from anxiety
Good.
if he stays calm.
You
Wonderful.
don't need two hysterical
No,
queens.
we don't.
Wonderful.
I tend to hide my stress and my anxiety.
Me too, from you.
So, but I can still see it in you, though,
Yeah.
because I've learned to what to look for, what to watch for.
And that is so wonderful, right? Even when we hide our anxious thoughts, I love that you both are able to recognize that it's more than just thoughts or what we speak. It's also what we carry in our body, in our faces, how we show it in our body language. And what a beautiful thing that you're able to really exude calmness that is really helping Scott in those moments. And that's a strength for you all, right? That's a real coping mechanism. Absolutely. And now we're going to take it a step further. I want you to, Paul, tell Scott what your favorite part about his face is.
His eyes.
Yeah. What do you see?
I see everything about him through his eyes. I see his soul in his eyes. And I think that's why I'm able to recognize when he's stressed or about to be anxious or is anxious about something.
Nice. And Scott, what do you notice in Paul's face? What's your favorite part about it?
Well, I know he said my eyes, but it's his eyes too. Because they're the window to the soul.
And that makes a lot of sense why you all were able to really calm each other through your eye contact. And that's another thing to remember as a coping mechanism, is that for both of you, eye contact is a really powerful regulator, right? You can co-regulate each other when you're anxious through your eye contact, through your presence and your body language. Yeah. Paul, after doing that, do you notice anything different about Scott's body language?
He's a little calmer.
Yeah.
He's not as tense.
Yeah. Where do you see that?
In his body language.
Yeah, in his body language. Wonderful. Good. We're going to add something in when your chest is tight or when you're sweaty. Sometimes it can be hard to calm our physiological or our body sensations. So I'm going to teach you all some breathing techniques that can help with this, okay? So I want you to place one hand on your belly and one hand on your heart. Wonderful, wonderful. And I just want you to start breathing in through your nose and out through your mouth. Good, good. You can close your eyes if you want. In through your nose, out through your mouth. And as you breathe in, I want you to push your belly against your hand. And as you breathe out, I want your belly to contract. And you'll notice your belly expand and push against your hand as you breathe in, and contract as you breathe out. Nice. Excellent, excellent. And keep going at your own pace. You can do the same pace as your partner or a different one. Good, excellent. What do you notice as you take these deep breaths? In your body, in your partner's body?
I'm having a dizzy spell.
Okay. You get a little bit of a dizziness, a lightheadedness. Don't normally breathe this deep.
Right.
Okay. Are you getting anxiety along with that?
No.
No. Good. Excellent. That's wonderful to be able to recognize that you can have dizziness. It can be there, and it doesn't necessarily mean the end of the world or you're going to die. Good. That's excellent. Sit with that. Perfect. What about you, Paul?
I feel relaxed.
Feel relaxed?
I realize
Good.
I missed my afternoon nap.
Good. Do you notice anything about Scott?
That he is relaxed. He is. I
Yeah.
see no anxiety, no stress, nothing on his face at all right now.
Good. Good. Awesome. And so this is something that you can do when those physiological, those body sensations come up that often trigger those anxious thoughts. Oh, I'm going to have a heart attack or another PE or another sort of kind of fatal something that's scary. You can do these. It might not decrease the fainting feeling, right? That might be having to do with blood pressure or other complex medical things, but we want to reduce the anxiety, the thoughts that come along with it. And this is one of those ways to really calm ourselves with our partner. Okay. Do you think you all could try this at home?
Sure.
Yeah? Awesome. I think that if you can do this when you can relax. If you can do that when those symptoms come up so that we're not, catastrophizing or thinking of the worst case scenario, right? You can see how calm and your energies are, calm and connected you both are when those kind of scary symptoms come up. And then you're able to better make a decision about, hey, is this something that I need to call the doctor about? Or is this simply anxiety? Or is this something that I need to go right to the ER, right? You're able to have more of that calm body, stay in that window of tolerance we talked about to make better medical decisions for your husband and for yourself.
I see. Yes, of course.
Does that sounds like a good plan for you all to continue?
Yes.
Cool. And you know what we can do is revisit this at your next medical appointment with Dr. Williams.
Okay.
I or another behavioral health provider could come in and show you just another tool that you can use next time some of those symptoms pop up.
That'd be great.
Awesome. Well, thank you both so much. It was so wonderful to meet you. It's clear you're extremely connected. And Scott, I'm so glad you have Paul to kind of help manage those symptoms. And I'm really glad that you all came in today.
Thanks so much. It was good
Thank
meeting you.
you.
Thank you.
Lastly, we involve care coordinators in our patients' visits. Cardiovascular patients often require significant medical appointments and medications, resulting in financial maelstroms that often increase stress and anxiety across families. Just as behavioral health professionals help the family navigate coping, emotions, and family dynamics that result from the stress, care coordinators can play a crucial role in aligning patients with resources that reduce or target the massive socioeconomic and resource burden that healthcare costs often lead to.
Hello. Hey,
Hi.
Scott and Paul.
Hello.
Hey again.
Hi.
So this is Maria. She's
Hi,
our
Maria.
care coordinator here.
Hi, Maria. How are you?
And
Good,
we
nice to
talked
meet you.
about a lot of kind of the resource management, a lot of the kind of financial stress and also all the paperwork that kind of goes along with leaving the hospital and all the bills that come with that. So Maria's going to talk with you all about a couple things around that. Would that be all right?
Sure.
Cool.
That sounds great.
Well, thank you, Maria. And I'll be back in a little bit. All right?
Sounds good. Thank you.
Thank you, Maya. Okay, so as a care coordinator, we normally help our patients with finding resources outside of the clinic, such as housing, where to go for food banks if needed, helping out if you're having trouble with your health insurance, and things like that.
I see.
Okay. Something else that we'd like to do is also help you review documents called advanced directives. And one of them is called the Medical Durable Power of Attorney. Have you completed one of those, Scott?
I personally have not.
Okay. Well, I can certainly get that form for you and review it with you if you'd like.
That would be great.
Okay, we can do that.
That'd be wonderful. Thank you.
Given the high risk for delaying treatment for cardiovascular events, cooperation between physicians and behavioral health professionals is essential for delivery of evidence-based assessment and interventions that address both underlying cardiovascular concerns and anxiety. Family-centered clinicians can provide vital support in bridging assessment, treatment, and intervention of the role of anxiety within the individual and the family or couple in order to help reduce physiological symptoms that may present in both cases. Undiagnosed or unmanaged anxiety in cardiovascular patients is associated with increased ER visits, further straining an already stressed healthcare system. By utilizing families and partners in interventions that manage anxiety on a daily basis at home, we can both relieve the burden on the healthcare system and, more importantly, ensure increased success in long-term patient outcomes, specifically around mental health. Utilizing families in interventions can help reinforce the treatment plans you create in the office and also increase social buffers and support for the patient. We hope this video sparks creative conversations and ways to incorporate the biopsychosocial lens with families in your practice. We're looking forward to continuing the discussion on innovative family-centered approaches in primary care. This video was created for the AAMFT, American Association for Marriage and Family Therapists, in collaboration with Family Therapists in Healthcare Settings Topical Interest Network and the Collaborative Family Healthcare Association's Family and Health Special Interest Group. A huge thanks to our providers and patients in this video, all of who gave up their time and energy to produce this video. Thank you.